Hi, everybody. Welcome back to the Doctoring Duo podcast, where you get real, unfiltered, and honest opinions about medical school and medical school admissions from two real, average, pre-med, and now medical students. My name is Eleni, and I am at the Penn State College of Medicine. As a reminder, I don't speak on behalf of my school, only on behalf of myself.
Hey everybody, I'm Noah. I'm a medical student at Mayo Clinic Alex School of Medicine. And just like Eleni, I speak for myself and not for my institution.
Great. And so today our topic is going to be all about the interview. So last time we talked about the waiting game, kind of what to expect when we're waiting, the pitfalls of comparison, the timeline, how to take care of yourself. Now we're moving into interview season, I would think. Interview season is in full swing. I think a lot of them have already gone out and there's a lot more still to come. And so we kind of wanted to give you guys a little bit of a primer on what to expect and how to take care of yourself and how to prepare your best for your interviews. So to begin, there's two types of interviews. There's closed versus open. And then under those, there are two subcategories where you have a normal, like could be like a one-on-one or a panel or a group of people, and an MMI. Noah, do you want to introduce us to the concept of closed versus open?
Yeah, for sure. So to start off, a closed interview, what that basically means is that the admissions committee or the person who's conducting your interview doesn't have access to your file. They probably know your name, your college, they might have access to like your GPA and MCAT, but they don't have access to other parts of your application. Or they might have it flipped the other way around. They've read your essays, but they don't know your GPA and MCAT, so they don't come in there with a bias of like, this is a really smart person because they got a so-and-so score on an MCAT or they have this GPA and they really want to know about you and your story. Versus in an open interview, they have full access to everything. They've read your primary, probably, definitely your secondary, and they know all about you, and you need to be prepared to talk about everything that's in your application. In a closed interview too, you need to be prepared to talk about anything that you wrote, just because if you wrote it down, it's probably important.
Yeah, and kind of adding on to closed interviews, I think that there's something interesting about a closed interview in the sense that at least the ones that I had were a little weird. So I had a phone interview that was a closed interview, and he didn't really know anything about me, and so there really was very little follow-up. So I would say something and I would give the answer to the question, and then he would say, okay, great, let's move on, because he really didn't know how to, I guess, give feedback in that way. Whereas I think on a regular interview, right, they know who you are. It's like, okay, I talked about, what I think a physician should be. And then, all right, I'm going to ask you about what's on your resume or on your application. And that makes a lot of sense in terms of flow. So just kind of be ready for that. I'm somebody that plays a lot off of facial expressions and feedback I get. And that was something that was very challenging for me during closed interviews.
Yeah, I will say I agree with Eleni with what she just said. I think it's hard to have a conversation with somebody who doesn't know a lot about you in general. Um, and I will say I did enjoy my open interviews a lot more. I had one interviewer who asked me specific questions about my personal statement. And for some of you, that might ring alarm bells and be like, oh my gosh, they actually read that. But yes, they do. But it was a nice personal touch. I wrote a lot about the importance of listening and what that means to being a good doctor. And he asked me a specific question about that. And I found that really meaningful. That means that he got what I was trying to convey and why I think certain qualities that make a good doctor are important. So, really to wrap that all up, closed interviews, they don't know a whole lot about you. Open interviews, they do. Be prepared for the different dynamics that each may bring and, just enjoy the ride.
Yeah, and I think open interviews are a lot more personal. And I think honestly, my open interview at Penn State was the reason why I got in, because I spent literally the entire time with this one. I had two interviewers, and I spent the entire time with this one talking about my teaching experience. And this was actually her field of research, and I didn't know that. And she was very passionate about a story I told, and we really, really connected. And I think that made a difference. But kind of like thinking about the open interview, I will come back to MMI in a little bit, but I think that this segues us really well to how to prepare. And I think the most important thing you can do is read your application.
Yeah, I would definitely, if and you should have the time because this is the pursuit that you want to do for the rest of your life, you know, do yourself a favor, read over your application, be familiar with what not only you wrote, but maybe come up with some extra stories that you didn't share in your application because they've read it. And if you just regurgitate what's on your primary and secondary application, that's not very useful because they're not getting anything new about you. And the interview is really about finding what they don't know about you. They know enough that they like you. Now you're trying to give them something else to push you over the edge versus other applicants. So I'd agree with that.
Yeah. Just, it's awkward, right? Especially if you wrote something about yourself. And, if I said, "Hey, Noah, you know, like what class, like what was your hardest class that you took in undergrad?" And he's like, "Oh, it's like, it's a little suspicious." Or, "What about this activity? Like, Eleni, what was your favorite time scribing?" And then I was like, "Oh," and I said I had 500 hours of scribing. Well, that's a problem, right? That makes it seem like you didn't actually do what you were doing, when that may not be the case.
Yeah, for sure. I think it's important to know what you did, why you did it, and why it's meaningful. Those three things are going to carry you not only in your primary and secondary writing for our friends who might be a little late to the game, but it's pretty late as it is, but especially as you're getting into interview season. I think it's really useful to go over those three things that I just mentioned. Another thing that I'd like to talk about, and Eleni will has some thoughts on this as well, is practice. Now, I put on here when I was typing up my little notes for today about like to practice with your friends and family. Now, I don't know how it was for Eleni, but like for me, if I had my parents and they sat me down, they're like, "So Noah, why do you want to go into medicine?" I just couldn't. I can't do it. It's just like too awkward. I know them. It's weird. I always did better with strangers or something more official. If that works for you and you can do it with family and friends, then definitely do it. Um, but you might want to go to some official mock interview practice, which we'll talk about next, but I'll let Eleni share her thoughts on that.
Yeah, I went to my parents, but that's because I know that they'll roast me, if need be. My dad does a lot of hiring, and for obviously he does sales, so it's very different than medicine. But I think that he knows what he's looking for in an answer, and they're very unafraid to tell me. And I think that just making sure that you get that unfiltered feedback from somebody, doesn't have to be your parents, doesn't have to be the professional office, doesn't have to be your friend, just whoever you feel like and you can trust to give you that feedback. I actually had an advisor when I was at UVA, a dean who I worked with in housing at the beginning. Her husband was a resident. And so she knew a lot about interviewing, that kind of thing, because she was with him during that time period in his life. And so she was a great resource. Like we called, we talked, we did practice interviews together up until I got accepted. So find somebody that will give you honest feedback, I think, because yeah, it feels good to be like, "Oh, you're so great," but if you're making mistakes, I think that it's important for somebody to tell you, even if it hurts your feelings. And it did hurt my feelings sometimes. Uh, but I think that it was helpful in the long run, more helpful.
Yeah. On the same way that I think, it's important to have other people in your corner who can, criticize you from the outside. I think it is important in this instance to be a good self-critic. And Eleni and I, we both had virtual interviews. I think all of our interviews were virtual.
I think
Um,
everything is still
and
virtual.
everything is still, and it probably will be for the foreseeable future. Especially for people in this cycle, almost everything's virtual. So one thing that I would definitely recommend is to record yourself, like practicing questions and like watch how you speak. Because I don't know about most of you, and you see it as I'm speaking right now, count the number of ums and ahs that you say, because it's probably a lot more than you think. And make sure that you're looking at the camera, you're making good eye contact. It's weird looking at the green light in your computer instead of looking at the screen. It's something to get used to. So, because it's kind of artificial when you're interviewing with someone and you're looking at the screen and it doesn't look like you're engaging with that person as you would in real life. So it's just something to keep in mind.
Yeah, and also like the positioning of your eyes is very important. So I did a couple mock interviews for some people I knew in my undergrad. I can tell if you're reading. I know if you're reading off of something. Don't be the guy that gets rejected because you were caught reading or your interviewer thinks that you're reading off of a script during your interview. So make sure that you're actually practicing and that you can kind of pull it out. Because if I'm sitting here, like this, and I'm reading something, I have our notes pulled up. No, it's obvious, right? I
Yeah,
mean,
right.
it's
Yeah.
obvious that I'm reading. Even if I'm talking to you, it looks like my eyes are elsewhere, and I think that's that's probably one of the worst things that you can do. It's disrespectful, and it looks like you're trying to cheat the system.
Yeah. And on the theme of preparing, I do want to make a quick note actually about being too prepared. I actually think there is such a thing as over preparation when it comes to interviews. I think as far as like official practice, maybe like do 2 or 3 mock interviews and have like smaller bits of prep along the way. And if you are fortunate enough to get a decent amount of interviews, your first couple of interviews will kind of actually be practice. You don't want them to be practice, but reasonably they will. Um, I think it's important, to come off as genuine. And, if you have a rehearsed answer, well, medicine means to me because I like to help people and I've always been fascinated by the human body and blah, blah, blah. Like that's not authentic. That's not you. Why do you want to go into medicine? Is it a family member? Is it you have just always had this true passion for helping people in need, and you think that medicine is the best way for you to go into that and have your reasons why? Because there's lots of professions where you can help people. One of the most difficult interview questions, and I'm sorry if you ever do get this question, is why do you want to be a physician instead of X? That can be one of my interviewers noticed I was a psychology major. She's like, why medicine, not a psychologist?
Was this EVMS?
This was VCU.
Oh, EVMS asked me the same question.
Did they?
Yeah.
Yeah. So, and it's actually, a hard question to answer because you can reasonably achieve your same goals in other fields. It's really a question about introspection and do you want it? Do you know what you're going into and do you want it? And so just be prepared for that really hard question at some schools.
I'm a big believer in showing, not telling.
Mhm.
And I think it's easier to get away with in a speaking setting, right? Because if I said to Noah, I'm a really compassionate, empathetic, and kind person, and I really want to help people. My delivery changes the way that he might believe me or not believe me, right? But if I wrote that on a piece of paper and put that on a secondary, it's like, well, these are just buzzwords. So I still believe that a story is the most powerful. Like I said, for my Penn State interviewer, that's how I connected with her, telling a story about my student. And I did the same thing for why medicine, right? I told a story about a patient that I connected with when I was working in the emergency department and how that was very impactful to me. So really see if you can't find a story for each question that you prep. But I do want to kind of talk about questions that you should prep for every school. So as we mentioned, SDN is a really good resource. There will be like a question threaded on like the first post typically of that thread, and you can see like interview questions from past years. I recommend pulling the ones that you think are the hardest and then prepping off of those. Even if you don't have any of those same questions, you will still feel more prepped and more confident in your delivery. But for me, there was always like a couple, 3 questions I prepped for every single school. I'm gonna see if I can uh, pull one up. But it was why medicine? Like your why medicine answer needs to be good. It needs to not be cliche as much as you can, and you need to have it down pat. Like that's the big one. Why this school is the big second one. I think pretty much every school I interviewed at asked me that question at some point. Um, the one school that didn't ask me that question when I was on the wait list gave me a call and said, "Hey, you're high up on the wait list. Why do you want to go to this school?" So I had to answer it anyway. So just always have that prepared, those two. And I think always have information on curriculum, research, that kind of thing. And so the way I built my why this school question, I usually did it 3-pronged. So the first was something attractive about either the curriculum or something unique that it offers. So I can talk about Penn State. So for Penn State, I was very attracted to the humanities curriculum, and I talked about like all the great opportunities here, like Lion Care, which is our free clinic, and Brave Cubs, where you can like dress up as a princess and go, cheer up sick kids. So first is activities or curriculum. Second is research. I think that showing interest in research is big, especially if you have a background in research. Find a lab that appeals to you, that matches with your current research if you do it, and say, hey, I think that I would fit well in this lab because my work does this. It's not a commitment, but it shows that you're doing research on that school. And then the last thing is kind of up to you. You can put in another activity. If you did curriculum for the first one, you can do location. I had a couple schools like Penn State where like I had residents that were very influential on me and like were my role models. And I mentioned that for those schools. And I think that really showed that connection between us. I know I talked a lot. Noah, what were your must-have questions?
Yeah. I actually think those are perfect questions to have. Is like, why medicine? And everybody says not to be cliche, and while I agree with it, every personal statement, when you really get down to brass tacks, is about helping people and why you love science. Like, let's be honest here. But you have to find a creative story to tell that. And so does your interview answer, whether it be a patient story. Eleni and I both wrote about patients, and I wrote about a patient scenario that had an impact on me and a physician who had an impact on me. As far as researching into the school, I do agree with that. I'll talk a little bit about the Mayo side. And no, Mayo's not paying me to like say this about their school. But one super cool thing about Mayo is we have things called selective weeks, where in between blocks of our curriculum where we're learning the main preclinical basics of medicine, you can go and shadow, you can do research, you can take vacation time. It's a way to enrich your education in a way that's not possible at a lot of other institutions. Another thing is Mayo is world renowned for its interdisciplinary approach to care. There's no other place in the world where you're going to see the number of specialists all coordinating care for one patient that you will at Mayo. And another part is like the culture. Our primary value is the needs of the patient come first. And every healthcare institution obviously wants to put patients first, but I think Mayo is really a place where they put their money and their actions where their mouth is. They really mean it, and every physician here really deeply cares. So those are what attracted me to Mayo, and being able to effectively convey that in my interview, probably really went a long way. I think also things that can convey interest in the school, and not everybody is going to have the time or the resources to do this. But I would try and connect with some students, and get a feel for the culture of the school, ask questions that, aren't easily looked up. And then, some schools, Mayo is one of these schools that cares about things like letters of interest or letter of intent, and you can write about those experiences as the interview cycle progresses.
Well, I feel like I have to sell Penn State now after such a convincing job. But yeah, like it's very clear that Noah was well researched when he went into his interview. Don't get caught not knowing something about the school. Obviously, you're not going to know like everything, right? But like have like a few decent reasons. Don't just be like, oh, my boyfriend's going there, or it's cheap, right? It doesn't sound. I think close to home is a valid one.
Yeah,
If you
close to
talk about
home.
having a support, like a good support system, but I would caution you against like be honest, but don't say things that make it sound disingenuous, if that makes sense. Find the honest reasons why you want to go, and research it so you can come across that way. Yeah. So let's
Yeah,
see.
I think I will build off that comment a little bit about like superfluous reasons of trying to make yourself sound good. A school shouldn't be on your list, and you really shouldn't be interviewing at a school if you wouldn't consider going there. So hopefully you've already done that legwork early on of like finding interesting reasons to attend to that school. And please, for all that's good, do not go into your interview and say, I want to come to your school because my great 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 grandmother is like from the state and like therefore I have like a tight connection. Like, that's just not genuine. So like Eleni was saying, if you have family there who you're genuinely close with and you think that's going to give you a good support system through school, by all means, or you have a significant other who has a job in that city and you'd like to be close to them, that's valid. But I think for the most part, your reasons for wanting to go to a school need to be related to that school and not, necessarily the surrounding area. That being said, like cities and what aspect, like where you want to eventually practice are valid. So, if you want to go to school in the city and you're like, I've always seen myself in an urban environment, that's fine.
I want to qualify that a little bit. I think that being very choosy like that is a luxury, and being totally honest, it's a luxury for people that are higher MCAT scorers. And I know that was the case for you, Noah, and that was not necessarily the case for me. And so I had a lot of schools on my list that, maybe would not have been in my top 10 or top 25. But if that was my only acceptance, I would have gone. And so obviously, if you're a top scorer, amazing, pick and choose, do what you need to do. But if you're kind of more in my boat, I want to encourage you to look for the good things, because I think that I would have been happy at any school on my list, even though there were some that maybe I like more than others. And I think it's just, what can you say that's positive about that school, right? And how would you take advantage of those opportunities? But because at the end of the day, every medical school is going to have roughly the similar things, right? It's mostly about the nuances and the details, and that's what they really like. So look for those nuances and details and look for things that you can love, right? I'm not a city girl. I don't like the city, but I did interview at a couple schools in big urban centers, for example, Washington, D.C. And so I didn't talk about loving the city because that wouldn't have been true. But I talked about being close to home. I talked about the free clinic opportunities, especially helping women, right? And that I think really did come across as genuine. So my advice is take advantage of what's there, if you don't have other options.
For sure. And that is a super valid point. Yeah, I would say, yeah, if you don't have the absolute luxury of like, there's some people on Reddit who like have like a 5.25 and like 4.0 GPA and they applied to like 10 schools and they like got into like every single school. Like if that's not you, like you definitely, are gonna have to will into existence, you know, your reasons for potentially going to that school. Before we actually move on about what to do on your big interview day, if it was okay with Lenny, I actually wanted to circle back to MMIs real quick. And
oh yeah, sure.
yeah, and talk about that interesting experience. I think Eleni and I were talking before we started recording, and I actually believe you did not have any MMI interviews.
Which is weird. I mean, you'd expect, like, I didn't have like a crazy amount of interviews, but I had a decent number, more than a handful, and not a single one was an MMI.
Wow,
which was weird.
that's actually really interesting.
Yeah, it should be a record.
Yeah, it should be a record because for those who don't know, MMI stands for the multiple mini interview. It's an increasingly popular interview format, especially among medical schools, along with, tests like Casper, where schools are really trying to get a feel for the soft skills of applicants and not just the hard numbers. It's an effort on their part to try and get past some of the hard metrics that have previously been used in admissions. So what a multiple mini interview basically is it's 6 to 8 stations, each with a different interviewer. Each station lasts 3 to 5 minutes, and you're given a prompt. Usually they're behavioral. An instance, say like a patient comes in with this, and this. How would you react? And they're not looking for you to diagnose and treat and like give you everything that a doctor is expected to do. They're looking for you to approach the situation with empathy and understanding and to see all sides of an issue. Another thing they might ask a controversial question. One controversial issue that was brought up in my interviews is tattoos in medical settings. Like, is it okay for medical practitioners to have visible tattoos? And I had to argue for or against, and you might have to argue for or against a certain proposition. I actually did like my MMIs. It was sort of like Casper, but in verbal format. And, like I said, it's really about take the time in that minute or two that you have the prep to try and understand every side, form a coherent response, and take solace in the fact that after you move on with that one station, that interviewer's graded you, and now you get a new interviewer. So if you feel like you messed up in 1, 2, or even maybe 3 stations, you can still end up doing really well in your interview because it's graded summatively. And that's really what it's trying to eliminate, is the individual bias of 1 or 2 interviewers and get multiple eyes on you. So if you have a school with an MMI format, you get that interview invite. I think that actually is a time where it's worth maybe perhaps to go to an official prep company, maybe if you have the resources to. It's just such a different format than most people are used to, and it's not really commonly used in the workforce, I don't believe. So it's different enough where I think you need to do an official run through versus you can get away with like the other interview formats with just having friends and family. Or at least go to your career office, like a pre-med advising office might have some official MMI prep resources.
Yeah, I did do MMI prep. I never got an MMI because it was free through my pre-med office. And I remember there was one about, it was a practice question about, it was, do you give like very expensive HIV medications to a patient that's very likely to be non-compliant? Like who had a history of like alcoholism and like drug use, but like they really need it. And like, what do you do and how do you have that conversation? There was another one about like a patient who was insisting on like a holistic treatment and was like, no, you're trying to like, you're trying to scam me. Like, I don't believe in this. And like, it's like, how are you going to be respectful of like their culture and like, their choices while also like, having a meaningful discussion about what treatment you propose. So very
Yeah,
Casper.
yeah, very Casper. I do want to say that, a couple of things actually. So I would take the time to lay out what arguments each benefactor or like stakeholder has in the issue. So like say like the issue that Eleni brought up of like an complicated patient who like needs a medication but might have some non-compliance issues. You need to examine it from like the perspective of the physician, from the patient, maybe from, you can go really macro and like from a societal, how should we attack this on like a systemic or policy-wide issue. But if you take a stance, I would defend it. They're not looking for people who are going to back down at the slightest hint of resistance. So if somebody pushes back, of course, recognize if you're wrong or recognize that viewpoint, but, they want you to see, can you form an opinion and then defend it? So that's what I would say.
Unless it's something concerning, like don't be like, I'm gonna scream at the patient and make them feel bad about themselves and then defend it because the old adage is right, there's no wrong answers, but there are wrong answers, right?
Very true.
I don't know what people might say, but like, I wouldn't treat this patient because she's a woman and I just feel like she's too emotional, she's probably lying. Like that is not something you should say. And residency, don't take that clip of me saying that out of context.
Out of context.
Right, so just don't, like, be smart, don't say things that are concerned, and my hope is that you wouldn't have those thoughts anyways because of the profession that you're going into, that you would be compassionate at first, but just consider it and make sure that your gut reaction is right before going
Right.
forward.
Exactly. You should have a gut check and you should be like, take a scenario about a patient, ask yourself, is the answer I'm about to give, is that how I want my mom treated, my sister treated, my friend treated? If that's how you wouldn't want your family member or friend treated by a physician, then it's probably on the wrong side of the spectrum. That being
You don't
said,
you don't have a sister, Noah.
yeah, I don't have a sister, so
So who are
my,
you thinking about?
my dog Hershey is my sister, okay?
Okay. All right.
But still along that line of reasoning, what Eleni was saying, read the room. I think not that interviewers are out to get you, but one question I got asked, there was like a lot of background about driving safety, and the question was about policy-wide initiatives about preventing speeding and being on your phone while you drive. And then the interview returned to me, have you ever driven and like been looking at your phone? And that's like, whoa, like take a moment and think. You're like, okay, is he about to judge me for the answer that I give? But I think I read the room correctly. I did get an acceptance to the school. So for whatever that's
What did
worth,
you say?
what did I say? I said, so I think you have to approach these types of questions carefully where they're asking you directly about your behavior.
Yeah.
I think in the instance if they're asking you about something problematic, like driving and being on your phone, you have to be very careful with how you answer. I answered it in that, yes, I have done it before. Here's why it's wrong. And here's why I realized it's wrong. And, I said, like, I unfortunately have done this. But, I since that instance, I have not. And this is why, because it's not my right to, potentially end somebody's life over my inattention, So I think if you're honest about it and you can share some good reflection about something in your past that you've done, that's fine. Of course, if somebody asks you a question about like murder, nobody's gonna be like, oh yeah, I'm so glad you reflected on your murder. So like, just,
Jeez. We went
just
from texting and driving to 0 to 10 real quick.
yeah, 0 to 10 real quick. But
All
my
right.
point is, have honest reflection and just think about think before you speak. And that's a rule for life, and especially in medicine.
Think about what you learned. I think that's the biggest thing. What did you learn?
Okay.
So I think we've really beaten this one to death, about
Yeah,
how to prep. So kind of summarizing this big chunk. Know the differences between the types of interviews and prepare accordingly. Utilize your resources, whether that's your friends and family, whether that's your pre-med office, whether it's your cousin, whether that's your coworkers, whoever it might be. Make sure you're getting honest feedback. Go to SDN if you want to find good questions to prep with. Um, and make sure you're prepping basic questions like why medicine and why this school. It's a good idea to prep at least a few days beforehand just to make sure you're comfortable, but maybe not 2 weeks beforehand. Might be a little too much. Overall, be confident in yourself, know your application well, and make sure that you're prepared and there's no reason why you shouldn't do well. Moving on, let's talk about the actual interview day itself. I just want to say my first tip is, especially if you're virtual and you're like, I'm going to be really smart, I'm going to wear a suit on top and then like my underpants on the bottom. Be aware if you stand up and go to the bathroom and you forget to turn off your camera, you do not want the dean of the School of Medicine to see your underpants. Like, that's not a good look.
not a good look. Just don't be that person who's in boxers as you get up to go use the rep, please. I beg you. I don't need to see that. The dean of the medical school doesn't need to see that.
So just be mindful, and also be mindful of your like background.
Yeah.
Like, if you have like a lot of like weird things behind you.
I've seen some weird things in applicants' backgrounds, not gonna lie.
Yeah. I'm not gonna say anything. I don't want to pass judgment on people, but I have seen some interesting things in people's background. But for example, like unwashed laundry, that's not a good look. Like,
Right.
at least move it to the floor so they don't see it.
Yeah, like Yeah, what Eleni and I, what we're trying to get at is at least make it, you've gotten all dressed up, you look presentable, so should the room that you're in. It doesn't have to look like a millionaire's bedroom, but it needs to look like, at least have a blank wall or have some nice artwork or something. I'm not saying go out and buy things and make your room look pretty, but it needs to be presentable at the very least.
Just don't have like unprofessional things
Yeah.
in the background. Like, for example, like I personally would not have like a giant poster behind me, like I don't know, like a bunch of guns, right? Like that would
Yeah.
be a red flag, I think.
Yeah.
Or like hanging a bunch of guns behind me, like things like that. Like be yourself and don't be afraid to be, but like also don't give them a reason to reject you from
Yeah.
the way your room is or the way you're dressed.
Yeah, exactly. I think like a good rule of thumb of it, if there's anything expressing violence, not a good look. Um, I don't know how other people feel about this, and maybe it's a little bit of a hot take, but I don't think posters with like political slogans need to be anywhere. Even if your interviewer agrees with you politically, um,
You don't know
not
that.
you don't know that. And just I would stay away from politics, both in your interview answers and in your interview decor, for the most part, unless they directly ask you about it.
Yeah. Um, so kind of how the interview day works, at least virtually. So I can't really speak. I don't think either of us can speak to like an in-person interview day, but like virtually, usually they start in the morning. It tends to be an all-day thing. It depends on the school. Some schools they'll do like information session and they'll schedule out your interview like at a separate day. Like I had one school that was like, you need to go to the info session tomorrow. Literally, they sent me an interview invite. They're like, you need to go tomorrow because you're in this group of interview applicants, and then your interview is like a month out. And it was really weird. So just like keep track of your dates. But usually they start like in the morning. They'll run like a few hours, like they'll do like 2 hours, 2, 3 hours of like school stuff, like opportunities, curriculum, like financials, that kind of thing. And then everybody will break out and go to the interviews. People usually get like their own time. They're usually not more than 20 minutes to half an hour. I don't think I have anything
Yeah.
longer than that.
Mhm. MMIs can
And
run longer, just to be of note, just to like have
yeah,
that out there. MMIs can be anywhere from 45 to 45 minutes to an hour, but yeah, your traditional interviews probably aren't going over half an hour.
right. And you break out, you might have one interviewer. I've had a few one-on-ones. You might have a whole group of people looking at you. I've had like three in a room. So
Yeah.
just like sometimes you'll know the names too, so like you can look them up, and that's always a good thing too. Like I had an emergency medicine attending interviewing me, and so like I asked him questions about his research, and like I think he really liked that. So use that to your advantage if you can. But I think that's a general overall. Sometimes I'll do lunch with students. I know I'm actually signed up to do a lunch with Penn State interviewees on Friday, which is really exciting. And that's a good time to like ask unfiltered questions, like how's dating, how's social life, like how's that kind of thing. And I think like that period is super helpful as well.
Yeah, definitely. I mean, if the school doesn't make, those informational sessions mandatory, I would still go. Like Mayo has like Sunday hangouts for our medical students, and I'll probably do one of those this year. I like Eleni said, it's a low stress environment, to get to know the school. These are your future classmates if you end up at that school, get a vibe. Like, are they, you know, high strung? Are they chill? And not that high strung is a bad thing, but you can get a lot of a feel from the school from its students, because the students ultimately make up that culture. So I would say, and like Eleni said, if you get an interviewer's name, even if you don't ask them specific questions about research, I wasn't super heavily focused on research, so I tended to not ask questions about that because I didn't think it would be super genuine. But if you can ask specific questions about the research or clinical care or what have that's all good.
Yeah. Also, this reminded me, and something we didn't cover in preparation. So, kind of going back to that, it might be a good idea to prepare questions to ask, because at the end of every
Mhm.
single interview, they will ask you, "Do you have any questions for me?" And it's not a good look if you're like, "Oh no, I'm fine." right? It shows that you didn't really look into it and you didn't really have any like extra thoughts. So I think it's important, like, look things up. It doesn't necessarily have to be about that person, but just like programs, or like how does like rotations work? Like, can you explain like how like pass fail at this school works? Like things that maybe weren't covered in orientation, but that are still pertinent. And what I would do actually during like the orientation was like I would like sometimes like make a note of what things I wanted to ask more on, and then maybe ask them during my interview. And I thought that that was helpful. Personally, I would also steer away from like super personal questions, like where did you meet your husband? Right, that's weird.
Yeah, that's weird.
But like, why did you choose this place? Like,
Mhm.
why did you choose Mayo Clinic, or why did you choose Penn State? And I think that gives them a really good opportunity to talk about the good things, and that also gives you a vibe on what this school values, right? I've had multiple different answers. I had one that was just like they had a job here for me, and I was like, okay. And I've had others like talk about the community and like people that care about each other. So, really, I think that's a great question to ask. Like, why did you choose this place?
Yeah, it's an awesome question to ask, especially if you've noticed um, that if you have an interviewer who's been someplace for 20 or 30 years, that is rare to find. I think they have some good insight. If somebody's been somewhere for almost as long as Eleni and I have been alive, then presumably that's a good place. And it's important to know the reasons why that person really likes it there. Like Eleni mentioned, you know, asking if you have a particular area of interest. I know Eleni's really interested in women's healthcare and impacts on women's health. If you have a specific interest like that, it is worth asking the school, especially in maybe today's day and age, to ask maybe about specific programs that affect your area of interest, like women's health, or let's say recently street medicine has become an increasingly popular field with like unhoused individuals. So if that's an area of interest for you, definitely ask about those, and that can show not only how you are unique, sorry, and what you could potentially bring to the school.
Yeah, but also be open. I think the worst thing would be like showing up and like, what's the plastic surgery department like? I'm not gonna do anything but plastic surgery. Nothing wrong with wanting to do plastic surgery, but I think it's important, especially like because you haven't started and you haven't rotated and like you haven't done that thing, like that you're not super set on one thing and they're like, I'm interested in this, but I'm open, and like making that clear, I think is important, and I think humble as well.
Yeah, definitely, for sure. Everybody comes in with their own interest in what they think they're going to want to do in medicine. I know Eleni and I kind of both came in with maybe some ideas of what we want to do. I'm really interested in mental health, so psychiatry is a standout field for me. I know OB-GYN is a standout field for her. But both of our interviews weren't like, I'm gonna be the best psychiatrist ever if you let me into your school. Like that wasn't the tone of our
Yeah,
interviews
or
at
like
all.
I'm only gonna do psychiatry. Like I don't care. But I do think like my emphasis on primary care, like I did talk about how I wanted to do primary care and like how the patient connection was very important to me. And I think that did help. So if you know that if you want to do primary care, or like you're very passionate about surgery for a certain reason, I think that is also good to mention. Um, cool. So we're kind of getting towards the end of our time here. Um, do we want to talk a little bit about like self-care during the interview and after the interview?
Yeah. I think, especially the night before your interview, everybody, especially your first interview, you're gonna be nervous. Um, but so it's important that eat a good dinner, sleep, have a good breakfast right before your interview. If you have the opportunity to log on maybe a couple minutes early and just have your camera off, take a second to breathe. It's going to be okay. You have done all the hard work. You have taken one of the most rigorous college preparatory courses available. You have taken the MCAT. You have done well on your MCAT, or well enough to be interviewed. You have done myriads of volunteer and medical work. And now you've gotten an interview and any medical school is a prestigious institution in this country, and in the country it's an accomplishment. MD, DO, Caribbean, be proud of it. And just know that you've put in the hard work to get here. And now it's just about being a normal human being. Believe me when I tell you, it's about being a normal human being. If you can hold a conversation, you can give interesting and well-reasoned answers to questions, you're going to be okay. It's going to be fine.
Yeah, my advice is not to worry too much afterwards. And I think like self-care is also really important. So like afterwards, like I would always go to the same Chinese place and like get food. I went there anyways, but it was my excuse to get it. And like I would like treat myself to Chinese food, and like I would take the rest of the day off because I was still an undergrad and Noah was too. So like I would just like
Yeah.
not study.
Yeah.
And that was that was good because it was like, okay, like I've had a stressful day, but like I'm de-stressing with like food and like a game or a movie or something like that. And also like I don't know if you did this, but I definitely like called my parents after and like I kind of
Yeah.
debrief with them and I was like, this is what I said. Like, what do you think about this answer? Like, how could it have been improved? And like I think that really helped because I don't really know how much feedback they were able to give me, but I think it was more because they didn't actually hear the questions themselves. But I think it was good for me to like think about what I had done and like reflect and say, oh, maybe I could have said this differently, or maybe I could have, sounded more sincere here. And like, how can I fix that? Because a lot of questions tend to overlap with each other in different interviews. So that debrief was important to me and for my self care as well.
Yeah, it was super important for me too. The first call that I made were to my mom and my dad, after the interview, and to talk about, they're like, the first thing, how did the interview at so and so school go? Tell me all about it. Um, it, like Eleni, it was a way to, not necessarily vent, because none of my interviews went particularly bad per se, but it
It was
was
venting.
just
I was stressed.
yeah, it was just very stressful. Your blood pressure is elevated like through the roof. It's a stressful time, no matter how pleasant the interview goes. So if celebrating with friends and family, getting particular foods that you like are all great ways to cap off an extremely stressful
Stressful.
process that is applying to medical school. You finally made it to the end of the road, and now you just get to revel in your hard work until those results come in, and whether you found out what happened. I think the bigger thing is, like, I don't know how it is for Eleni, and like pre-meds, we are neurotic people, but I would do your best to, after you have that day, to like vent, de-stress, like talk about it with your parents or friends or whoever. If you have those people in your life you're comfortable talking about with it, forget about it, move on. If that's your first interview or your 10th interview or however many interviews you had, like, it's time to move on, focus on the other things in your life, then come back to it once those results are in, and then you can reflect and go from there.
Cool. Well, Noah, do you want to kind of summarize us up and then we'll wrap it up?
Yeah. So, this was a fairly long episode. We covered a lot. Like we said, we went over the different types of interviews: closed, open, 1-versus-1, panel, MMI. We spoke a lot about preparation, about different resources that you might use, making sure that you have answers to why medicine, why that school, are all really important take-home points. On interview day, breathe, relax. You have done the hard work. You have done it. And what I really want to stress to everybody on a last note as we finish this up, as everybody's in interview season, is celebrate it. You've made it. You've gotten your interview. You've done how you did. And now it's just time to wait and find out if all that hard work paid off, and it most certainly will.
the hardest hump to get over in application season is getting the interview, because I think usually less than 10% or less of applicants get an interview. So if you get an interview, be proud. There's not many of you. And, you know, recognize that that was the biggest obstacle, right? And so now that you're in the interview, do the best you can. All right. Well, thank you so much, everybody, for listening in on our longer episode. This is the Doctoring Duo podcast with Eleni and Noah, your favorite doctoring duo. Next time we'll be around Halloween, and we'll be talking about how scary are preclinicals. You know, I was just thinking it would have been more appropriate to do Casper, but I realized nobody takes Casper in October, right? Like Casper the Friendly Ghost. You know what I'm saying?
Yeah.
Thanks for the fake laugh. Okay.
You're welcome. I guess people are done with taking Casper right now, aren't they?
So we'll do that on like an April-May episode way down the road for next cycle. So we'll talk about how scary is at medical school actually after we've been in for about 3-4 months, and we'll meet you guys then. So until then, take care, and we'll talk to you later.
See you guys.